everyone. This is Dr. Karamanchi. I wanted to chat with you about coronavirus and how the cases are trending right now. Um, there is a lot of confusion about like if there are more cases now versus before, and if there are more deaths versus before. So I reviewed the overall numbers in the states, and it seems there are more cases. The trend is going up each day. Uh, but the number of deaths, even though the deaths are going up each day, total new deaths from new coronavirus cases has gone down each day from the overall trend in the states, which is good news. That means there continues to be mortality, but the number of deaths based on new cases is going down each day. So as you know, a lot of these patients with coronavirus, they stay in the ICU sometimes for 2 weeks, sometimes for 4 weeks, and even 6 weeks, and eventually we'll know if they passed or if they stayed alive. So sometimes there is a lag time. So hopefully in the next 1 month or so, we'll have a better trend on, how the cases are trending. So that's a brief update about the coronavirus. I wanted to chat with you about. Recently, some of the things that I noticed in terms of the new cases that are coming through. We recently had a client who had coronavirus, and he had multiple other medical problems prior. He had heart issues, diabetes, cholesterol, high blood pressure, and a whole bunch of other problems. Um, you know, so he had coronavirus, and then they kept him in the hospital for a few days, sent him home. He came back, and they kept him again in the hospital for a few days and sent him home. And then he came back a third time, and this time he had a abdominal aortic aneurysm. Aneurysm is essentially a swelling around the aorta, which is the main blood vessel running through the back. And in the wall there was a leak, and he already had a previous history of problems with the aorta, with the aneurysm, where the aneurysm was leaking, and he already had a stent. And in spite of having a stent, he continued to leak, and we had to transfer him to a tertiary hospital to get a procedure done. And by reviewing the case, based on his history, I felt that the reason why the aneurysm was leaking is not because of prior issues, but because of COVID-19. Obviously, he had probably some inflammation in the wall of the blood vessel, and that made it prone to rupturing again. So if you have a family member or if you yourself have an aneurysm, so that's something to know about. If you develop COVID-19, it can affect the aneurysm in a significant way, where you need to be watched in the hospital for signs of leaking or rupture of the aneurysm. Sometimes when there's rupture, then there's increased bleeding, and that's a life-threatening situation. So I wanted to bring that to your attention. I also wanted to share another um, situation that we noticed in COVID-19. We had a whole family, husband, wife, and kid, who were sick, and they all had similar COVID-19 symptoms like fever, cough, and everything. And the family was dismissed home. They were doing okay, but the husband eventually developed symptoms of stroke. So when they examined him again, he had to come back to the ER, and they did some scans, and they noticed that the stroke was really bad, and he had a large clot in one of the vessels in the brain. And they had to fly him to another tertiary hospital, and they did a procedure where the radiologist goes through the groin, do a catheterization, and they retrieve the clot, and after that he felt better the next day. So I wanted to bring that case to your attention because you can have COVID-19, but then you may have signs of stroke. You may have numbness, you may have weakness on one side, and you should be aware that COVID-19 can cause issues with the brain. It can cause increased clotting in the blood vessels supplying the brain, and that can lead to symptoms and signs of stroke. So in this particular client, he was diagnosed immediately, and he was treated immediately, and hence, he recovered. I don't know if he recovered completely, but he had a significant recovery based on what I read in the paperwork. So that was good news. But in this client, he was treated within the 3 hour window. So if you're having signs of numbness, tingling, and headache, if you're having weakness on one side, if if you're having classical signs of stroke and you don't get medical attention, sometimes it may be too late and you cannot get the treatments for stroke. And in those situations, you may have to rely on physical therapy and other therapies in short term to long term to see if there's recovery of function. So similar to previous case, COVID-19 was causing inflammation in the blood vessels. It was forming clots. And interestingly, this particular client, when they dismissed him from the previous hospital stay, they put him on a blood thinner. Um, it was a prophylactic dose where the dose was less uh, um, to prevent blood clots. But in spite of the prophylactic dose of medication, he developed a stroke and he developed clotting throughout the body. So even though you may have COVID-19 and the doctor does everything per the book, and they put you on a blood thinner, in spite of that, you may still have clotting in the system. You may have clotting in the blood vessels, in the body, also in the brain, causing stroke. So that's something to be aware of. If you know somebody who has COVID-19 and they're having some neurological symptoms, then make sure that they get checked out and they get treated. So these two were really interesting cases that I came across recently. I want to quickly share those with you. So COVID-19 to sum up, COVID-19 can affect people who have an aneurysm. It can cause rupture. It can cause leaking of the aneurysm. COVID-19 can also cause symptoms and signs of stroke, and both those situations can be life-threatening, and they need to be treated immediately. So again, my overall goal is to prevent these types of situations to essentially not have this infection where your body's immunity is strong, and that requires taking supplements, taking nutrition seriously, eating more fresh produce, eating more vegetables, greens, trying to avoid sugars, working on your overall immunity, doing exercise and everything else we talked about in enhancing lifestyle. If you want personalized guidance, feel free to DM me. If you have any questions about what I taught, send me a DM. Also subscribe to my channel. I look forward to talking to you all again. Okay, have a wonderful day. Bye.